Welcome to the Solus Pump instructional video. My name is Charlotte Hubner and I am a staff development educator with MJHS. In this segment, I will show you how to change a bag or a reservoir for a patient who is receiving an infusion. The key for the pump is kept on a rubber band around the pump when the infusion is going. That way we all know where to find the key for the pump, and we have it when we need it. The pump has an on-off button here on the side. It also has an area to physically lock the cassette onto the pump, and we would use this part of the key for that. On the left side of the pump, there's a spot where we could hook up a wire with a button for the patient to push for a PCA dose, but typically what we use is this PCA button that's on the front of the pump, because the wires kind of get in the way and get tangled. Unless the patient is more alert, it might be appropriate then. We could hook up this pump to a wall outlet for power, but in our situation we usually use the batteries. They last for about a week. They do last a week for most patients with an infusion, and so we'll stick with the batteries most of the time. On the front of the pump, you see the screen and some of the action buttons. Here, these two buttons, the white buttons on the right and the left under the screen, are action buttons. So when we turn the pump on here using the on-off button, then it will allow us to use these action buttons to tell it what we want to do. And these are the lights that show us if the pump is on and not infusing or on and infusing. The menu here under tasks allows us to decide what we want to do and navigate to where we want to go using these up and down arrows and the select button that will allow us to decide what it is that we want to do. The stop and start button will stop or start the pump. It will ask us, are you sure you want to do this? Yes or no? And then if we want to start it, we can push the yes. There are more than one type of reservoir. Typically what you will see when you're out with a patient is the IV bag, and yet sometimes the pharmacist may send this type of a reservoir, which has a hard side. It's more tamper-proof, and we may be more inclined to use this if there's a situation when there's a potential for some drug diversion in the home. And finally, what I would like to show you is that there's this blue clip that when you go to change a bag, it's typically on the bottom of the cassette, and this is something that you would remove and discard before you attach the cassette to the pump. And that is an overview of the features of the CAD Solus pump. The first thing you want to do when you're changing a bag is to prepare the patient. Offer her a bolus dose prior to stopping the infusion to make sure that she will be pain managed while you're making the change. Advise her that there will be some beeps, but that the medication will not be infusing during the bag change, lest the patient be concerned that she may be getting more doses than what she should. You want to think about the 5 rights of medication administration. Verify the accuracy of what you see on the new bag, or it may be a reservoir like this. Either way, there will be a label on it that the pharmacist has filled out with the information as to what is in the reservoir, and double check to make sure that this matches with what the physician order is. And you're also looking to see what the concentration is of the reservoir, whether it's one of these hard-sided or reservoirs or a infusion bag, IV bag.